Number one, we've got a lot of new employees, right?
Thank you.
And they've not been exposed to this sort of stuff before. So what you as licensed techs and doctors know or think you know in terms of radiation safety, that's not always passed on to everyone around you. So this meeting is to make sure that everyone has the same knowledge that the people that have been trained in this area have. Now, radiation is always a boring meeting, but this is for your benefit, so that's why we're doing it. You've got 3 handouts. One of them is your quarterly dosimetry report. I'm going to go over this with you in terms of what you should be looking at and how to read it and how to understand it. One of them is a 5-page.
Or out of all the other ones, there's only these 2 up here.
Okay. The other one is a 5-page handout from Universal Consultants. This is a physicist company, and we are probably one of the only veterinary facilities that I'm aware of that has had a physicist come in and evaluate their environment in terms of safety for employees. So this is interesting reading material if you want to look through it. Just kind of see what the physicist has to say about our environment. I'm going to read a little bit of this, but not all of it. The instructions, the radiation safety operating procedures, this is for your benefit so that you have this if you want to go back and review anything. I'm not going to go through this particularly, but what I'm going to do is a PowerPoint presentation that covers all the information that's in here. So if you're unclear or you have questions, you're welcome to come and ask me or ask Michael, who is your new radiation safety person. And or go to this and look and you'll find whatever information you're interested in. So it's interesting, one of the stimuluses for me to say that it's time for this meeting was that we got a report back from our radiologist that we had fingers on a film. And that's probably one of the first times that we've ever gotten that. I looked at the film and I thought, I don't really see that. But sure enough, up in the upper, somebody was holding a cat and they had their digits in the primary beam. So we're going to explain what the primary beam is. We're going to talk about scatter radiation. We're going to talk about things that you should do to protect yourself. But fingers in the primary beam is an ultimate no-no. So the radiologist who read that said, this is unacceptable. If this continues, you're going to get reported. So we need to talk to everyone about the fact that that's happening. Now, interesting enough, Dr. Lamb was telling me about x-rays that he got from another clinic.
2 sets of emails, their full hand was in the x-ray.
Yeah.
I could see every digit.
Yeah, so they haven't had this meeting, so maybe we'll go over there and give it to them next. All right, let's take a quick look at Universal Consultants. I'm going to read a couple things here from, this is a friend of Dr. Krupka's, who's a physicist who came over and set up the lead in our x-ray room and in our CT room and talked to us a little bit about safety when she was here. And I had some questions for her, and she then replied, and this is the reply that she sent me. And I'm starting about midway down the first paragraph. The animal hospital works with very low levels of radiation compared to a regular hospital setting. Anyone above ALARA level 1, 125 millirems, will be notified upon receipt of the badge report. So this is the badge report that I gave you. Your badge that you wear when you take radiographs is being read by an outside company. So if you go over what they consider to be a acceptable level, you are going to be notified by us, because they are going to notify us when you hit 125. At that point, we're going to have a sit down with you and we're going to talk with you about radiation safety and what you're doing that's getting your badge level up so high. When your badge level goes over 250 per quarter, now they're coming in. So it's not up to us anymore. They're going to come in and evaluate what's going on and watch and pay attention and actually talk to you specifically. So What's the likelihood of you going over 250? It's very, very small. So what does that mean? So REMS is what we're talking about in terms of radiographic exposure. Your exposure is what's showing up on this quarterly dosimetry report. So every 3 months, they're gonna send this report out to us. Now, when you look at this report that I gave you, this is the latest thing that Molly had printed up. Your individual quarterly numbers aren't on there because this report was printed prior to the point where they had that quarter. So this first section is blank, it shouldn't be. When this is posted downstairs, that first section will be your exposure for the last 3 months. So that will be probably within the next few days, this latest report will come up. When you look at that, your deep, eye, and shallow are the numbers that you're gonna be reading. Deep radiation exposure is the most significant. That is what is gonna cause potential problems for you, and we're gonna talk about what those potential problems for. So when I look at this, when I read this, I read deep, and that's what I'm evaluating. Your shallow and your eye doses are very superficial radiation exposure, and when you read the limits that you can have in terms of eye and shallow, they're like exponentially higher than what you can get when you read your deep dose. So when you read your deep dose, that's what's important. That's what you want to pay attention to. So that first section is your quarterly, then it has a yearly report for you, which is the next section, and then it's got a lifetime dose report for you in terms of what you've had for radiation exposure. So if you ever leave here and you go to another hospital or another place that has radiation, this goes with you because they need to start where we left off. And if you're coming here from somewhere else, then this should come with you because that lifetime amount should be a continuation regardless of where you're at and where you're getting exposed to radiation. So what's the possible limits for you? So the most significant limit for you is 5 REMs. 1 REM is 1,000 millirems. So your yearly total that you can get is 5,000 millirems. That's an annual limit for you. Now they start paying attention when you hit 125 millirems per quarter. Has anyone hit 125 per quarter? Never. So are we gonna have a problem here? Unlikely. However, in the past, many, many years ago, before we paid attention to this, and we had shields and thyroid guards and hand protection, radiation problems for veterinarians and for staff in veterinary hospitals was a lot higher. And the consideration there was cancer, leukemia, other sorts of problems. So what we were trying to achieve is limiting that possibility that you are going to have any sort of health effects related to radiation exposure. So when you read this, 125 is your questionable area where we're going to start talking to you. 5 REMs or 5,000 is your annual limit that you're allowed to have, but the board is going to step in when you start going over 250 millirems per quarter, and that's not going to happen. One thing that we need to start doing is we need to start wearing our badges anywhere we're exposed to radiation in this hospital. So we have been kind of reluctant or not feeling it was important to wear our badges in the dental radiography room. We're not going to do that anymore. If you're working on dental procedures, you need to be wearing your badge. And your badge is worn at the same place regardless of where you're at, which is right at the level of your thyroid gland. It's always outside of your lead protection. It's not inside, but that's the level that you wear it at. One of the most sensitive tissues is your thyroid gland. So that's the level that we put the badge at, and that's where your readings are going to be. So if you're taking a CT, or if you're in the dental suite, when radiographs are being taken, that is where your badge should be, and you should be wearing your badges at all times. Now that said, the badges should not leave the building. Make sure that your badges always go back where they go at the end of the day. The reason for that is that environmental factors are going to affect that badge. So sunlight will affect that badge. Microwave will affect that badge. There's some radiation that's coming out just out of the earth that's going to affect that badge. People actually emit a little bit of radiation. So there's a lot of things that are going to affect you that are not necessarily the X-ray machine. In a year's time, in terms of natural exposure, just being outside and being exposed to radiation, you're going to get about 375 millirems of exposure to radiation in the environment without even being around X-ray equipment. So we don't want that showing up on your badge. So let's keep the badges in the hospital. When you're done with them, put them back where they go. One of the reasons that we did not use badges in dental radiography is because the dosage of that was so low. Back when we were using films in radiology, or even in digital x-rays, the film requirement was a lot higher in terms of the radiation dosage. So when we went to the electronic reader for the x-rays in dental, the dosage of radiation went way down. So we thought, well, we don't really need it, and as a matter of fact, the people that were setting up equipment for us said, no, you don't really need it. However, if you're really being careful, you should be wearing your badge at all times, and that's why we're upping our game a little bit to do that. One dental radiograph is the equivalent of about 24 hours of environmental exposure. So that's not much. And yet, it's the cumulative effects of multiple radiographs, dental radiographs through the course of the day, and extremely multiple radiographs during the course of your work life. So that's what we're trying to limit or bring down. So any questions on how to read the quarterly report? This is posted every 3 months, every time, and it's in the radiology room. You'll look at it and it'll be the same, and then it'll change. So it does get changed every 3 months when a new report comes in. If you want more information than that, you're welcome to call this service that we use, and they will give you whatever information you're looking for.
In dentistry, 8 feet's the distance as to where you get to 0. So if you're on the table next door and they're shooting a radiograph, just get up and move. Get 8 feet away from the primary.
So yeah, a dental x-ray is really no different than the regular types of x-rays. We said what the dental exposure was. The ways to limit your exposure in dentistry are ALARA. So that's a term that's used a lot by radiologists. ALARA is as low as reasonably achievable, which means that's what you're trying to get to, is your radiation exposure as low as possible. So your ALARA levels, a level 1 ALARA is that 125 per quarter. So a level 2 ALARA is the 250, and that's where they step in. So that is actually, it means how much radiation you're being exposed to, and that's how it's being evaluated. So those ALARA levels are the way that dosimetry people will kind of evaluate what's happening in our facility. So distance, like Dr. Lamb said, shielding is important, although shielding in radiology is probably very difficult to do. The dosimetry badges and the digital sensors that we're using is how we limit radiation in dental. Now, what's 8 feet? if you're taking an x-ray in that middle table, 8 feet makes it all the way over to the wall. So if I'm taking an x-ray in the middle table, and I have people feel like they're 8 feet away and they're standing over by the computer, you are not 8 feet away. So when you're taking an x-ray in that middle table, you need to be at least over to the doors that come into that area. So, and people are very lax on that. And that is not the way to be. It is a safety thing for your protection. We got a lot of young ladies working here who may or may not be having babies in the future, and that is the most significant issue, is exposing your ovaries or the male parts to radiation. We don't want that kind of damage done. Male parts, sorry. Ovaries sounds so much better. So 8 feet does not work. If you're 8 feet away, you need to be over. Now, if you're in that end table that's closest to the computer, then you just need to clear out of that area and get over by the first table that you come in, and that's about 8 feet. But you're not getting 8 feet of protection. Now, how does that work? Well, the radiation's coming out of the equipment, right? And it's localized down into what you're taking an x-ray of. So if you're taking an x-ray of a tooth, the radiation is going down towards the mouth. The problem is that the coning on that, a lot of times, is not always centered down. Ideally, you need to have that cone facing the ground. If your cone is off to the side like this, then your primary beam is heading out towards wherever that is. So I see x-rays being taken in the middle table that are pointing towards the other table, and people on that other table think that they're safe, and that's not true. Now you're even more exposed because your cone is pointing towards you and you're getting closer into the primary beam area. So make sure that if you're taking an x-ray, or if you are in the room when an x-ray is taken, that you pay attention to your own safety. So yes, we're going to monitor that, but we can't be in there all the time. It's going to be up to you to make sure that you're keeping yourself safe. All right, so let's talk just briefly about what sort of harm x-rays potentially can do. So damage is proportional to the dose. So if you get a dose of 350 rads, that is potentially lethal. If you get a dose of 50 rads, which is 10 times your yearly allotment, that has potential to make you pretty sick. So that's acute in terms of immediate exposure. You are not going to get that kind of exposure in this facility. The secondary, in terms of chronic effects, are increased risk of cancer, of the thyroid gland or the lymphatic systems, cataracts, thyroid tumors, bone or skin tumors. So those are the things that we're trying to avoid. And that's not that you're going to get that tomorrow. It's that it's cumulative over time, and in your job over the years, we're looking to try and limit your exposure over a period of time. All right, let's do So at one point, right, we want to scare you, and at the other point we want to say we don't have a problem here. But I would like you to feel like your safety is in your hands, and you need to pay attention to the rules and protect yourself. Because if we weren't taking precautions, the potential actually goes up quite a bit. So permissible levels are set so low, that means what they allow us to get, that clinical evidence over the past 50 years indicated no observable injuries to the medical personnel when the radiation limits are not exceeded. If awareness, caution, and common sense are utilized, the hazards associated with radiation exposure are only potential and practically non-existent. So if you do what we teach, you're gonna be pretty safe in terms of radiation safety. So let's go, are you gonna click that for me?
Yep.
I think one thing that's important is people understand how an X-ray is, how you get an image. So you've got, your electrons are shot down through the body, and it's reflection off the body that creates the image. So the more dense the tissue, so bone shows up white on an X-ray, that's because the electrons are hitting the body and bouncing back. They can't penetrate through, and so that's where you get into scatter. So taking 20 dental X-rays into a tooth, you're getting some scatter. So it's really important in dentistry to probably get away from that. You know, you gotta understand how the image is being produced, where something that's soft tissue, a towel or whatever, it's going through and straight down, right?
Right.
So, you know, the more dense tissues, dentistry, orthopedics, you know, those are, you're getting more scatter in those. So it's really important to wear your protective equipment during those
If
procedures.
you have a feeling that gloves, lead aprons, or thyroid shields are protecting you from the primary beam, you're wrong. If you think you can put your leaded hand in the primary beam and not be totally exposed to radiation, you're completely wrong there. The lead protection is for scatter radiation. You are getting a big dose of radiation if you're sticking your lead gloved hand into that primary beam. You avoid that primary beam like it's a cancer causing source. So definitely stay away from it. And collimation is the term that we use in terms of trying to come down on what we're trying to look at. And collimation, when you look at the light on the table, that's your primary beam. So you can collimate that primary beam down to look specifically at what you want to look at. So you want to look at the paw, don't have a huge primary beam all over the table, because now you're getting a lot more scatter radiation. So the collimation that you do on your body part when you're looking at it, every x-ray that we take should be collimated to some level. Don't have a big old x-ray area to give more exposure. All right, let's rock through this. All right, so only veterinarians are allowed to order radiographs. So that is part of law in Ohio. Let's go to the next one. Next one. Next one. So, and this kind of is for the doctors. Viewing previous radiographs is going to make us take appropriate radiographs, right? So if we're looking for something orthopedically, making sure to look at the previous radiographs before we order the next radiograph is going to be helpful, because it may limit or change exactly what you want to be looking at or what you're doing. So always review previous radiographs. Next. Collimation we talked about. All right, so the time that the machine is sending that beam down is the most significant. So when we're doing our techniques are pretty much already set in stone. But if you can increase the KVP and decrease the time, that's actually a safer radiograph that you're taking. So if you ever have an option of one or the other, it's increase your KVP and lower your MA. And mostly our charts are going to be doing that for you, so that's not going to be a variation. What's next? Next. All right. So in Ohio, we're allowed to hold animals. That doesn't necessarily mean that you want to do that all the time. Sometimes your best x-ray comes from a sedated animal, right? So if you've got a fractious animal and you're pretty sure you're not gonna get a good x-ray, you need to let the veterinarian know. Rather than taking a bunch of x-rays and having them turn out poorly and have to retake them because the animal was unhandleable. If the doctor wants very specific shots, then sedation is going to be a big benefit. And if, with a sedated animal, that is where you're using all of your ancillary things to position the animal, the bags and the troughs and whatever it is, so that you can actually get out of the room, taping a leg down, that sort of thing, or get further back. Your exposure in that radiation room is decreased exponentially by the distance that you move away from the primary beam. So your scatter radiation decreases extensively as you move back away from that x-ray table. In our x-ray room, we've got multiple things for your protection. Aprons, thyroid shields, gloves, and glasses. So what you should be wearing every time you take an x-ray is an apron, a thyroid shield, and gloves. Glasses are there for your protection if you want them. What are some of the most sensitive tissues? We already talked about that. The lens of the eye is sensitive. The thyroid gland is sensitive. The gonads are sensitive. So if you are taking an x-ray, most everything is protected except your eyes. So there are lead glasses in there. I would recommend wearing them. If you're not going to wear the lead glass, it doesn't help to close your eyes. The radiation's going right through your eyelids. It will help slightly to turn your head away. So if you decide that you don't want to wear the lead glasses and you're holding an animal for a radiograph, turn your head so that your eyes are not getting the direct scatter radiation. Okay, next. Yep, covered that. Next. Next. So in the CT room, the lead protection in that room is very extensive, but that means you're behind the lead wall. Doesn't mean you're standing in the hallway there or you're standing in the doorway. The glass is lead lined, the whole room is lead lined, even the door going into that room is lead lined. So number one, you never go into the CT room if it says in operation, or I would knock before I went in there, because you could be walking in as they're starting to, so if someone's in there, I would knock before I went in.
Is there a lock on the door? I don't know.
I
It
don't
gets
think
into
so.
CT?
No.
Maybe that's something we can put on there and
Yeah, I mean, the purpose of
somebody's in
the
there running
light
it.
was to let people know when it's in operation.
That may be a safety issue, because if you have somebody in there and they need help and they can't get to the door.
Next. Right, no unauthorized visitors allowed during x-ray exams. So that's where you are in charge of the room when you're in the room. Clients are not in the exam room when x-rays are being taken. People without badges are not in the exam room. So if you get a student that wants to watch an x-ray being taken, that's a no. If the student has a badge that they're wearing or that they brought with them, then that would be okay. But you are responsible for who is in the x-ray room and who's being exposed, and that is just people that are badged and under the supervision of our company that's monitoring that.
do our tech students come with badges?
They should be, yes.
Next. Yeah, we don't do fluoroscopy here, so let's shoot through. I think there's about 3 or 4 of those. We don't do portable radiographs either. All right, so any sort of a problem with the equipment needs to be reported immediately. Dr. Haddad would be the one that you would talk to. We're not gonna be using any faulty equipment, but if there's something happening with that equipment that is an indication to you that it's not normal, then that needs to be reported. That's a reportable situation. You need to let us know so that we can check the equipment and make sure that it's operating properly. I'm not gonna do that.
With regards to the equipment, the lead aprons, if you lay them down and let them fold, it breaks the lead, so they have to be hung appropriately. You know, don't throw them down on the table and so forth. When you take them off, put them back up on the things that hang on the wall, because it will over time wear and tear, break them down.
Per AHA, every 6 months, we're required to radiograph our equipment. Is Shannon in here?
She was downstairs recovering a dog when we came up.
Okay, so we've been a little bit lax on that. The last radiograph we did was maybe a year and a half ago. And when she radiographed our lead equipment for this AHA meeting that we have coming up, there were faults in a lot of things. So what you'll notice down there is everything that is down there now is brand new. So directly to Dr. Lamb's point, you cannot fold those lead aprons. You have to hang them, and the same thing with the gloves. The gloves should not be in a situation where they're folded up, and the thyroid shields also. I would strongly encourage you to wear your thyroid shield. A lot of people I see are not wearing those. They wear the lead aprons, and that's good protection for your body, but your thyroid is one of the most sensitive tissues, so wear your thyroid shield in addition to your aprons.
I noticed it's mainly with the straps, that when we hang them up, they're twisted, so we just wanna make sure that they're straight when we're hanging them up.
Yeah, the lead aprons. Okay, next. That's not important. So this, we talked about this in terms of skin and extremities and dosage and things like that. Typical vet tech dose, it says, is less than 100 millirems per year. I think some of our people are pretty close to that. So we take a lot of x-rays here. That's the type of facility that we are. I think that, you know, based on the 125 per quarter, you know, we are well under that and staying in what is considered to be a very safe range. Next. We did that already. Wear your badge. Wear it whenever you're around an x-ray device. We talked about that. Keep it away from radiation, so don't take it out to your car. Don't take it home. Don't get the badge wet. Don't open the badge. Yeah, that's good. And we talked about dose reporting. We don't use ring designers. Pregnant radiation workers. A pregnant person is legally allowed to take radiographs. We prefer that that's not the case. So in our hospital, our policy is anybody that is pregnant should not be in anywhere around radiation equipment. Pregnancy the fetal tissues are some of the most sensitive tissues to radiation exposure. They give a limit for pregnant people in terms of what they can be exposed to, and it's a monthly limit, and it needs to be monitored on a monthly basis, but we're just going to eliminate that whole situation. The most sensitive period is the first trimester. So if you're trying to get pregnant and you're in a situation where that could be happening and you don't know about it, I would probably avoid taking radiographs during that time. Next. We went through that, and that, and that, and that. covered that. Yep. Thyroid shields we talked, lead shield care, hang aprons, don't bend or fold, inspect shields for evidence of damage. So, yeah, with Mike, I would tell Shannon that she should be x-raying those every 6 months. And it has a dosage on how to take the x-rays. We can evaluate those ourselves, or if she feels like she wants to send them in, you can send in the radiographs to the radiology people that read IDEX, and they will look at them for you if you want to. But they're pretty obvious when they're not working. Next. I don't think that's important. And we went through that already. And we talked about that. And I think that's it, isn't it? Yeah. So if you would like to get more information on radiation safety, there is an E.Haddad course that you can take. You get credits for it if you take the course and answer the questions as they go. So if you need some additional CE, you're welcome to sign up and take the E.Haddad course for radiation safety. I think it's 1 CE credit. All right, any questions? Cool, thank you.